Hello everyone. We are glad to participate in this conference. Greetings from the Republic of Moldova. My name is Natalia Bivol, and I will present an important topic for our country, possibly for other countries as well. And our topic is drinking water supply and public health, trends and regional disparities in the Republic of Moldova. The drinking water supply constitutes one of the major public health challenges with a direct impact on morbidity and quality of life. Water used for drinking purposes can influence the occurrence of acute diarrheal diseases, viral hepatitis A, certain chronic diseases, and chemical intoxication. In this context, the national legal framework we have the law of drinking water, the water supply and sanitary strategy from 2014 till 2028 is harmonized with the recommendation of the World Health Organization and with the international commitments of the Republic of Moldova. The study aims to evaluate the impact of expanding public water supply networks on population health in the Republic of Moldova and to identify risks linked to the use of local rural water sources. The material and methods. The analysis was carried out on the basis of official statistical data provided by National Bureau of Statistics and the assessment of centralized drinking water supply system in the Republic of Moldova for the period of 2008 till 2024. The study examined the dynamics of infrastructure, number of aqueducts, length of public networks, and their territorial distribution, the degree of connection of urban and rural population to centralized sources, as well as the volume of extracted water and consumed. Indicators were calculated and interpreted at the level of development region. We have North region, centers of Gagauzia, another region, and municipalities. Using descriptive methods, 95% confidence interval, and trend models to highlight multi-annual developments. In the Republic of Moldova, the Nistru, Prut, and Reut rivers have the most economic and sanitary importance. The first two, Nistru and Prut, are used for centralized water supply. In addition, the several places these rivers also serve as sources for decentralized water supply. And we have the picture of these rivers. In 2023, the total length of aqueducts and public water distribution networks reached 20.8 thousand kilometers, representing a 3.5 increase. Compared with the previous year, the urban 84.8 in urban area and 545 kilometers in rural area. From the total length, 20.3 thousand kilometers belongs to operational systems, while 0.5 thousand kilometers are not yet officially commissioned but still serve the population. The largest share of new built aqueducts and public distribution networks was registered in localities of the northern region, 54.9%, and central region, 26.9%. Also in 2023, a total of 19.6 thousand kilometers of aqueducts and public water distribution networks were operational, representing 94.2% of the total length. And this graphic shows the length of public water distribution networks of operational system. We have here increasing and decreasing in different years. In these slides, we have localities of access to public water supply system by region in 2023. At the regional level, the municipalities Chișinău and Gagauzia have the highest level of connection to public water supply system, and the lowest is the north part. The last here in the graphic is the north part. Public water supply system predominantly extracted water from surface sources. In 2023, the total volume of extracted water amounted to 134 million cubic meters, including 85.7 million, what is 64% from surface sources and 26.6% from underground sources. And also we have 9.4% from other sources. On our results in 2023, the volume of water distributed to consumers amounted 97.0 million cubic meter, and the differences is 37. And this difference is between the volume of extracted and the distributed water. And here in this table, we see the differences, where is extracted, where is distributed. It's around 37 million cubic meter. From the total volume of distributed water, around 70.7% was supplied to the population, 4.4% to public institutions, and 24.9% to other consumers. We see the most of all it's for population. The expansion of access to centralized drinking water has direct implication for population health. The scientific literature confirms that the functional public water system reduces the risk of acute diarrheal diseases, viral hepatitis A, and other pathology associated with microbiological contamination of water. At the same time, decreasing reliance on local water sources, often exposed to pollution and to fluctuation of fluoride, nitrates, or heavy metal content, represent an important step in preventing chronic health problems, including dental fluorosis, what we have a lot in our country, infantile methemoglobinemia, and chronic intoxication. The conclusion. Republic of Moldova has made significant progress in expanding public drinking water supply networks, and population was connected to them, thereby contributing to improved quality of life and the reduction of public health risks. However, continued using water from the local sources, especially in rural areas, maintains the risk of exposure to substandard water quality. Continued investment in water and sanitation infrastructure, rigorous monitoring and sanitary chemical and microbiological indicators, and promotion of community education on the use of safe water sources remain essential for our country. And thank you.